In most states, once you are beyond the first 6 months on Medicare Part B, you usually have to answer a list of health questions and provide a list of your medications on a Medicare Supplement, also known as Medigap, application. Then that application is sent to an underwriter at the insurance company who determines whether or not you are eligible to purchase a new Medicare Supplement. This can be a nerve-wracking experience, but it doesn't have to be. In this video, we'll go through what kinds of questions are asked on Medicare Supplement applications, which medical conditions are likely to result in a denial, which medical conditions are not a problem for Medicare Supplement underwriting, and the situations when you don't have to go through underwriting at all in order to purchase a Medigap policy. Hi, I'm Tabitha Moldenhauer, broker with Benefit Consultants Midwest. If you haven't already, please take a moment to hit the subscribe button. We have new helpful Medicare content every week. Your first 6 months on Medicare Part B are your Medicare Supplement open enrollment period. During that time, you are able to purchase any Medigap policy sold in your state without having to answer any health questions or provide a list of your medications. So the first question is, why would you be purchasing a Medicare Supplement once you are beyond your first 6 months on Medicare Part B? There are many reasons why this happens. People successfully get through underwriting to purchase new Medicare Supplement policies all the time. If you've had a Medigap policy for a few years and the rates have gone up, you may be purchasing a new Medigap policy in order to keep the same level of coverage, but have a new lower monthly premium. Or you might decide to change your Medicare Supplement coverage from a Plan F to a Plan G, or from a high deductible Plan G to a Plan N, just to give a few examples. Or you may have been in a Medicare Advantage plan and switched back to original Medicare Parts A and B and want to add Medigap coverage. What kinds of questions are asked on the application? Every insurance company has slightly different health questions. This is to your advantage when working with a Medicare plan broker. Your broker can compare questions from several different companies to find the one most likely to accept your application. The health questions are usually very straightforward. The notes and instructions on the application tell you if your medical condition will result in your application being declined. If that's the case, you know before even completing the application that applying to that particular company would be a waste of time. With some health conditions, the Medicare Supplement company will consider your application, but it does have to be sent to an underwriter who may call you or your medical providers for more information in deciding whether or not to accept your application. What medical conditions lead to an application being declined? As mentioned earlier, every insurance company has slightly different applications. But in general, the following conditions are likely to cause an application to be declined. Number 1, necessary medical treatment that has not been performed yet. This is a knockout question for most companies. If your doctor has told you that you need surgery, testing, or treatment that hasn't been done yet, finish your testing and treatment before applying for a Medigap policy. Number 2, currently hospitalized, confined to a bed, in a nursing facility or assisted living, or receiving home health care. If you fall into any of these categories, you will most likely be declined. If your situation is temporary, you may be able to pass underwriting once all treatment is done and you are completely recovered. Number 3, currently being treated for internal cancer. Usually, insurance companies will decline your application until you have been cancer-free for 2 years. There is some variation depending on the type of cancer from one company to another. Number 4, recent medication changes. These may or may not be a problem depending on the insurance company and the medication. If your medications have been the same for more than 2 years, you shouldn't have a problem. However, if your medical condition is not under control and your doctor is still trying to find the medications that will work for you, that may lead to a decline. Number 5, serious chronic health conditions. Again, each company varies slightly, but if you have any of the following, you are unlikely to be able to pass underwriting for a Medicare Supplement policy. Rheumatoid arthritis, insulin-dependent diabetes with cardiac complications, MS, AIDS, osteoporosis with fractures, COPD and other severe lung disorders, dementia, Parkinson's disease, ALS, serious heart problems, heart attack, stroke, TIA, stent placement, valve replacement, pacemaker, congestive heart failure, kidney failure, and organ transplants other than corneal transplants. Which medical conditions are generally not a problem for Medicare Supplement underwriting? Number 1, high blood pressure and cholesterol. Unless these conditions are severe and require far more than the usual medication to control, they aren't a problem for passing Medicare Supplement underwriting. Number 2, osteoarthritis. While rheumatoid arthritis is a declinable condition, osteoarthritis is not. Number 3, BMI. Medigap applications do usually ask for your height and weight, but underwriting is pretty lenient. As long as you are not seriously obese, a high BMI on its own will not cause your application to be declined. Number 4, type 2 diabetes not requiring insulin. If you are taking medication for type 2 diabetes but don't need insulin and don't have any cardiac complications, you can pass underwriting for a Medicare supplement. Number 5, mental health medications. If you take prescriptions for anxiety or depression, you can pass underwriting provided you have not needed inpatient mental health care. Number 6, some types of cancer. If you have certain types of cancer, you can be approved for coverage with some Medigap insurers. This varies from one company to another, so ask a broker to research options for you if you find yourself in this situation. Underwriter phone calls and medical records checks. As part of the underwriting process, your underwriter may call you to confirm the answers that you gave on your application. It's important to both fill out the application honestly and respond to underwriter questions accurately and honestly. On the application, you agree to give underwriters access to your medical records, so any discrepancies will be easily discovered. The underwriter is only allowed to ask the same questions that were asked on the application. Keep responses simple and short. Sometimes Medicare Supplement applicants say far too much on underwriter phone calls and end up being declined based on information they gave that the underwriter didn't request. Once my application is in underwriting, can I assume I'm approved? No, do not assume that your Medicare Supplement application has been approved until you receive written confirmation of that. Underwriting can take up to 3 weeks. During that time, do not cancel your current coverage just in case your application is eventually declined. If you are approved, you will receive your policy or ID number and a copy of your policy either electronically or in paper form. Once you have that, it's safe to cancel your other coverage. If you are replacing a different Medicare supplement, your old policy will not be automatically canceled. You need to contact your old insurance company and request the cancellation. What if my application is declined? That's not the end of your options. Every company handles underwriting differently. There may be another Medigap company that will accept you. When someone is declined, the underwriter can tell that person what issue caused the application to be declined. And then your broker can look for a Medigap company that may be more accepting of whatever condition caused your application to be declined. In some areas, there are also guaranteed issue Medicare supplement companies that accept everyone who is age 65 or older and has Medicare Parts A and B. Another option is to keep your current coverage until the annual enrollment period begins in October and then look at Medicare Advantage plans available in your zip code. Are there times when you can switch Medicare supplements without having to answer health questions? Yes, there are guaranteed issue situations when you can purchase a Medigap policy without having to answer any health questions or providing a list of your medications. Examples of guaranteed issue situations include leaving an employer group health plan, moving away from the service area of your Medicare Select or Medicare Advantage plan, or if you tried a Medicare Advantage plan for the first time and chose to return to original Medicare within the first 12 months. There are also state-specific laws that allow bypassing underwriting. For example, in Washington state, you can switch from a Medigap Plan A to another Medigap Plan A, or from a Medigap plan lettered B through N to another Medigap plan lettered B through N at any time without having to answer health questions or provide a medication list. Going through Medigap underwriting can be stressful. It is much easier and more likely to succeed in you being approved for new coverage when you have a knowledgeable, experienced broker on your side who knows the underwriting differences between companies and can help you find a plan that fits your needs and budget and is most likely to accept your application. If you have questions about your Medicare Supplement or any other Medicare coverage, please feel free to give our office a call at 877-312-1414 or visit bcmwi.com. We're here to find the best Medicare coverage for you. Have a great day.